For over 30 years, Humana has been committed to the care of our members. Through our expertise and partnerships, we provide whole-person health care that adapts and evolves with you, no matter where you are on your health journey. Choosing the right Medicare plan can help you get the care you need to feel your best. That's easier to do when you understand your plan choices. Humana can help. There are certain times when you can enroll, disenroll, or change your Medicare plan. The annual enrollment period is October 15th through December 7th. During the rest of the year, if certain special conditions apply, you may qualify for a special enrollment period. Ask your licensed sales agent if you qualify. Let's think about your Medicare options. Option 1 is Original Medicare, Parts A and B, through CMS, the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but not prescription drugs. So you may need a separate Medicare Part D prescription drug plan. If you do not select a Part D plan when first eligible, you may be subject to premium penalties later on. Option 2 is Original Medicare, plus a Medicare Supplement Insurance Plan, plus a prescription drug plan. A Medicare Supplement Insurance Plan, or Medigap policy, helps lower costs by picking up deductibles and coinsurance not covered by Medicare Parts A and B. But these plans don't include prescription drug coverage. You will need a separate prescription drug plan to provide drug coverage. Option 3 is a Medicare Advantage health plan, also called Medicare Part C. Many Medicare Advantage plans also offer drug coverage, eliminating the need for a Medicare Supplement Insurance Plan or a separate prescription drug plan. You can get a Medicare Advantage plan with prescription drug coverage and MAPD through private companies like Humana. With or without prescription drug coverage, Medicare Advantage plans have all the benefits of Original Medicare and may have lower out-of-pocket costs. An MAPD plan is a Medicare Advantage plan with Part D prescription drug coverage. Most Medicare Advantage plans also offer extra benefits. As a Medicare Advantage member, you still have Medicare and must continue to pay your Part B premium. It's just the version managed by a Medicare Advantage company, like us, Humana, rather than the federal government. Now that you know your Medicare choices, how do you choose your plan? Ask yourself a few questions. What type of plan do you have now? What do you like about your coverage? What would you add to make it even better? Is someone helping you make healthcare decisions? With these answers, you're ready to look at plans. Let's look at a Health Maintenance Organization, or HMO plan. Usually, with an HMO, you choose your primary care physician and other healthcare providers from an established network of doctors, specialists, hospitals, and other medical providers. Humana has a large provider network, but if your current doctor is not in our network, the other benefits of the plan may be worth changing your doctor. You may use our provider directory to choose a new one from our provider network, even monthly if needed, until you find one who's right for you. The providers in our network agree to accept a discounted rate from Humana. With a few exceptions, we pass the savings on to you. In general, there is no coverage if you receive care from an out-of-network provider unless the services are required because of an emergency or urgent care received out of area, or your primary care provider has provided an approved referral for the care. When you are experiencing an emergency, go to the closest emergency room. Most HMO plans require a referral from your doctor for specialist visits. Ask your licensed sales agent whether the HMO plan in your area requires doctor referrals. CMS reviews and approves Humana's HMO plan yearly. Here's a fact that may be important in your planning. The Centers for Medicare and Medicaid Services prohibits combining a standalone prescription drug plan and a Medicare Advantage HMO, even if the HMO doesn't include prescription drug coverage. Ask your sales agent to review your options with you. You'll also want to have the agent review the plan's prescription drug coverage and specific drug list, the medications the plan covers, with you. Humana's list is also available at humana.com. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problems before we'll cover more expensive drugs. This is called step therapy. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand name drugs may be covered. In the coverage gap, or donut hole, you pay part of the drug cost before additional Medicare coverage kicks in. In 2019, you'll pay no more than 37% of the cost of many generics and no more than 25% of the cost of many brand name drugs during the coverage gap. If you have both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. Ask your sales agent if a dual-eligible special needs plan, or DSNP, DSNP, is a good choice for you. Now that we've talked about when to sign up, your Medicare options, HMO plan specifics, and prescription drug coverage, what's next? Your sales agent will go over two important documents. One is the summary of benefits, which covers many features of the HMO plan. The other is the plan's drug list, also called a formulary. If you choose to sign up for an HMO, we'll send your ID card in the mail. You can choose to receive other plan documents online instead of mailed to your home. Going digital is a great way to stay organized and have most of your plan information in one place. If you decide to go digital, we'll email you a link to activate your secure online account called My Humana. By providing your email address, you authorize Humana to send you health information at this address. You'll complete a health assessment by phone or online if you've chosen our online option. This is to see if you qualify for any special health programs. Be sure to attend a member orientation. We've covered a lot of information today, but if you have questions, call us.